뭐 때문에 왔어?
틱장애가 왔는데 비염 치료를 그동안 받았어요. 근데 저희는 이제 코가 안 좋으니까 코가 이렇게 하는 현상 있잖아요. 이렇게 벌렁벌렁. 그게 저희는 이제 비염 때문인지 알고 그동안 비염 치료만 받았거든요. 뭐 음성틱은 없는데 최근 들어서 가끔씩 뭐 이런 증상이 있고요. 처음에 시작한 게 뭐 이것부터 시작해가지고 머리를 이렇게 오른쪽으로 반복적으로 돌리더라고요.
운동팁은 여러 가지 하네.
그리고 지금은 자기도 모르게 평상시 괜찮은데 특히 걸어갈 때 어깨를 이렇게 해요. 그리고 잠잘 때 누워있으면 그게 심해지는 거죠.
언제부터 그런 게 있었어요? 엄마?
몇 개월 안 됐어요. 운동티 나타나기 시작한 건 8개월.
아이고요. 많이 써. 컨디션 어때?
그래.
괜찮아? 낮에도 착용하고 있어? 그 장치? 학교에서도 착용해?
그래, 하고.
어땠어? 어떤 면이 많이 좋아졌어요? 아빠 보기.
학교에 갔었는데 선생님이 이제 그 눈에 띌 정도로 뭐 전혀 발견할 수 없다고.
아빠 보기에는 점수를 쓰면 몇 점?
점수가 한 90점.
90점이나?
네,
굉장히 빨리 좋아져. 어땠어요?
이제 다 좋고요. 꾸준한 거 같아요. 처음에만 나빠졌다가 뭐 이렇게 이제 안 좋아졌다가 이렇게 하더니 계속 꾸준하니 이제 좋아진 것 같아요.
100점 만점에 몇 점이야?
90점.
아빠 생각은 한 애기 몇 점 정도 좋아진 것 같아요?
95점 정도?
95점 정도.
네.
그동안 어땠어?
지켜봤는데 저희가 생각할 때는 완치가 된 것 같아가지고.
아빠가 보기에는?
네.
아빠가 한 달 동안 지켜봤을 때는 현재까지는 전혀 안 나타나.
FCST is abbreviation of Functional Cerebrospinal Therapy. It is treatment to control whole body's yin yang balance through balancing TMJ. The purpose of balancing TMJ is upper cervical alignment, spinal alignment, nervous system stabilization, and natural healing of body. That is to say that FCST helps to open up the blood channel that connects brain and body, realigning the spine, stabilizing nervous system. What factor causes misalignment of spinal structure? The answer is in C2, which is the one and only central axis of the spine. Then why is the C2 important? Human body has 24 vertebrae, which includes cervical, thoracic, and lumbar. Of all these vertebrae, there is only one vertebra with an axis, the C2. Our body is affected as axis C2 is distorted. When the axis C2 is distorted, the LSC1 is also immediately distorted, and the rest of the vertebrae in the spine will soon follow, as will the pelvis and cranial bones, like in the domino effect. Consequently, it will lead to the cranial structure fixation and the restricted flow of cerebrospinal fluid. Then, there will be problems on the circulation and central nervous system. What factor causes misalignment of axis C2? The answer is imbalance of TMJ. Once the C2 are distorted due to the TMJ imbalance, the entire structure will follow and distort. And this will negatively impact on the brain-body communication through restriction of foramen magnum, as well as restriction of jugular foramen, another opening in the base of the skull transmitting veins and arteries. When the TMJ disc space is normalized through TMJ balancing therapy, C2 is aligned as well as the size of foramen magnum is normalized. I've explained in what aspect I see the disease and its principles and concepts. I put everything in one diagram for the summary. For the better understanding, I rotated the horizontal diagram in the previous slide into the vertical diagram. The treatment applied to the higher rank can be the treatment in the lower rank. In the lower rank, more specific therapies are applied. I consider balancing TMJ as top priority factor to resolve structural problems. For the TMJ balance, I make use of intraoral devices as our main treatment. There are two types of intraoral devices used for balancing TMJ. CBA is disposal custom-made intraoral balancing appliance which allows balance of TMJ at the optimal free weight space to the individuals until deflection. The purpose of CBA is to align C2 at all times through balancing TMJ in relation to maxillary and bodily posture. TBA and OBA are intraoral devices for keeping TMJ balance stable after the use of CBA when deflection has occurred, and keeping C2 in aligned position and stabilization of occlusion and mandible. I apply a wide range of therapies other than TMJ balancing therapy. These therapies are applied for structural alignment. There are upper cervical and spinal alignment technique, spine balancing therapy, craniosacral therapy, and disc decompression balancing therapy. There are other secondary therapies as well. Depending on individual's condition and need, I apply different types of secondary therapies like as acupuncture, cupping therapy, herbal medicine, counseling program, and rehabilitative exercise program. This chart shows the number of cases in my clinic from 2002 through 2013. I listed several diseases based on the highest ratio of patients.